Predicting obesity risk with genetic testing. Early interventions for a healthier future. Imagine being able to peek into a child's future health risks as easily as reading a report card. That's the promise of revolutionary genetic testing for obesity prediction. But the implications are far more complex than they appear. Groundbreaking research now suggests we might soon predict adult obesity risk before age 5 using DNA analysis. This isn't science fiction. An unprecedented global study analyzed genetic data from over 5 million people, the largest dataset ever assembled, to create a polygenic risk score that doubles the predictive power of previous methods. By identifying specific genetic variants linked to fat storage and appetite regulation, this test could flag high-risk kids early enough for effective lifestyle interventions. But here's where it gets controversial. This crystal ball works dramatically better for people of European descent than other groups, exposing a critical equity gap in genetic research. And this is the part most people miss. Even the improved score only explains 17.6% of obesity risk in Europeans, meaning over 80% hinges on environmental factors like food access, activity levels, and socioeconomic conditions. With global obesity rates skyrocketing, adult rates doubled since 1990, U.S. rates exceeding 40%, the urgency is undeniable. Yet experts emphasize genetics alone can't determine destiny. Identical twins with the same DNA often develop different body types based on lifestyle. The real value may lie in personalizing treatment. These tests could soon guide medication choices by predicting how patients respond to weight loss drugs. But should we label children based on genetic probabilities when environment plays such a massive role? What's your take? Is this a breakthrough for preventative health or a distraction from systemic issues like food deserts? Share your perspective below. New DNA test predicts childhood obesity risk, revolutionary tool for prevention. Imagine a world where we could predict, with remarkable accuracy, which children are destined to struggle with obesity in their adult lives. This is no longer a distant dream, but a reality made possible by a groundbreaking new tool developed by scientists. This innovative tool can forecast a child's likelihood of becoming obese in adulthood, opening up new avenues for early intervention and prevention. But here's where it gets controversial. While this tool promises significant benefits, it also raises ethical questions about the use of genetic information and the potential for stigmatization. Let's dive in to understand the implications and the science behind this revolutionary development. The new test, which analyzes DNA from a blood sample, is designed to identify children and adolescents who could benefit from targeted preventative strategies, such as diet and exercise at a younger age. This early intervention could make a world of difference in shaping healthier futures for these young individuals. The test is reported to be twice as effective at predicting obesity as the previous best methods, making it a significant leap forward in the field of genetic prediction. But this is the part most people miss. The test doesn't just predict obesity risk in children. It also assesses how well obese adults will respond to targeted weight loss programs. This dual functionality makes it an invaluable tool for both prevention and treatment. Assistant Professor Roelof Smit from the University of Copenhagen, the lead author of the research published in Nature Medicine, explains, what makes the score so powerful is its ability to predict, before the age of 5, whether a child is likely to develop obesity in adulthood. Intervening at this point can have a huge impact. This early prediction allows for timely interventions that can alter the course of a child's health trajectory. The World Obesity Federation predicts that more than half the global population will be overweight or obese by 2035. In England alone, nearly 65% of adults over 18 are already overweight or obese, and around 1 in 8 children aged between 2 and 10 are obese, according to the NHS. These statistics underscore the urgent need for effective prevention and treatment strategies. While options like diet, exercise, surgery, and medication exist, they are not universally accessible or effective for everyone. This is where the new test comes in, offering a more personalized and potentially more effective approach. The research behind this tool involved a massive collaboration with the consumer genetics and research company 23andMe, along with contributions from over 600 scientists from 500 institutions globally. The study gathered data on traits such as human height and body mass index, highlighting how subtle variations in our genetics can impact our health, including our likelihood of developing obesity, and even our appetite. A polygenic risk score, much like a calculator, combines the effects of different risk variants a person carries and provides an overall score. To create this score, scientists analyzed the genetic data of over 5 million people, the largest and most diverse genetic dataset ever compiled. They then tested the new risk score for obesity on datasets of the physical and genetic characteristics of over 500,000 people. Professor Ruth Loos from CBMR at the University of Copenhagen described this new polygenic score as a dramatic improvement in predictive power and a leap forward in the genetic prediction of obesity risk, which brings us much closer to clinically useful genetic testing. The test also assessed the relationship between a person's genetic risk of obesity and the impact of lifestyle interventions, such as diet and exercise. Interestingly, scientists found that those with a higher genetic risk of obesity were more responsive to interventions, but also gained weight quickly once those interventions ended. This finding underscores the importance of sustained lifestyle changes and continuous support for individuals at high risk. However, the new test does have its limitations. Despite drawing on the genetics of the global population, it was far better at predicting obesity in people with European ancestry than in people with African ancestry. This disparity raises important questions about the inclusivity and fairness of genetic testing tools. Should we be concerned about the potential for genetic discrimination? How can we ensure that these tools are equitable and beneficial for all populations? As we stand on the brink of this genetic revolution, it's crucial to engage in thoughtful discussions about the ethical implications and potential biases of such tools. What